We're going to talk about the NHS now because the Health Secretary has blamed a surge of flu cases, COVID and Strep A concerns for pressures the NHS faced over Christmas. Stephen Barclay says the situation isn't acceptable and the government is focused on freeing up hospital beds to help create more capacity and ensure ambulance handover times are reduced. It's the senior doctors say the service is in crisis, with trusts and ambulance services declaring critical incidents. Joining me now is Nigel Edwards, Chief Executive of the Nuffield Trust. Good to see you, Nigel. First of all, do you accept this assessment from Steve Barclay?
Well, I think the NHS was in significant trouble before the flu season arrived. And has been under huge pressure really for the last year. The number of things happening. First of all, COVID's still with us, so there's about 10% of the beds still got patients with COVID. We've also seen a big increase in patients waiting to go home or to nursing homes because the social care system is broken. You may remember that the Prime Minister, last but one, promised that it was going to be fixed. Unfortunately, that fix was largely aimed at protecting property rather than actually creating a social care system that functions. So people are stuck in hospital, which means the emergency departments are full because they can't empty the patients into the wards, which means the ambulances can't empty the patients into the emergency department, which means that the ambulances can't get out to see people. And meantime, general practice is under huge pressure as well. People seem to have become less resilient, and there seems to be more illness around, and particularly mental health and cardiac conditions as well. So there's a whole collection of difficult things all going on at once. But it's more complex than the Secretary of State suggests.
Yeah, what would you like to hear from Rishi Sunak? Which we are expecting him to talk about the NHS this afternoon. What would you like to hear from him?
Well, there's still unfinished business to sort out the perverse incentives associated with senior doctors' pensions that creates a big incentive for them not to do extra work and in fact even to cut their hours. So I'd hope that after lots of promises, and we've heard them from some now for over the course of at least two prime ministers, that those will be fixed, and that's still not fixed. Social care, they put some money in, but the problem is it's not enough to keep. I think if I was a social care provider, if I ran a business running social care, I'm not going to invest and take on extra staff on the basis of a short-term input of money. When I'm competing against Aldi and Lidl for staff, I can't increase my pay if I can't depend on that money coming in future, and if it's only a short. So I'd like a longer-term fix to the social care problem. We've got to do more to take pressure off general practice and stop people leaving. We've done quite a bit of recruitment, but we've not really done enough, I think, to stop the burnout that we're seeing, not just in this country, across the whole of the UK, and actually in other countries too. And that's an urgent priority to take the pressure off them. So there's quite a long list. Unfortunately, none of them are very quick because many of the problems are long-term and they will require long-term solutions.
Well, that's what I was going to ask you, actually. In the short term, to get us out of this hole that we're clearly in at the moment, what would you like to see? Because Wes Streeting, the Shadow Health Secretary, has suggested bringing in the private care sector to try and help alleviate the backlog.
That will help with surgery. I mean, in fact, the private sector already do quite a lot of surgery, but of course, it's worth remembering that the doctors who do that surgery are actually largely NHS doctors. So you aren't necessarily imagining up any additional staff. You may create some capacity that can be used, which won't be filled up by emergency patients. So the big priority, I think, is to get patients who are in hospital who don't need to be there, and there's about 12,000 or so of them, and that's about 14% of the total beds, out of the hospital into nursing homes, back into their own homes. And the only way to do that is to do something about the social care system. But that's not that easy because we're quite high we're quite close to full employment. Though there are a lot of people not working who perhaps could. Whether they can do social care is another matter. It's quite a demanding job. But we're going to have to pay some of those people more. We'll have to fix the 0-hour culture that infects some of that area of business. But that's the thing that would make the biggest impact, and it would unlock the system right the way back up. It would free up the emergency departments, it would free up the ambulances, and it would take some of the stress off the system. But even that's not an easy solution, but it could be relatively quick.
Nigel, really good to get your thoughts this afternoon. Thank you so much for joining us. That is Nigel Edwards from the Nuffield Trust.